Thank you for joining us today and welcome to Smith, Gambrell & Russell's live webinar on the topic SPDs, SBCs, and SMMs, Common Pitfalls. This is the second of 4 short presentations regarding healthcare and welfare plan issues. Today's webinar will be approximately 45 minutes. Please feel free to add your questions to the chat as the presentation unfolds. Should you have any technical issues, call Zoom support at 1-888-799-9666, extension 2, and reference webinar ID 555-397-743. After the webinar concludes, we will reach out to provide you with a PDF copy of this presentation. Laura Andrew will be presenting today's webinar. Ms. Andrew is a partner in the Executive Compensation, Employee Benefits, and Healthcare Practices of Smith, Gambrell & Russell, with a special emphasis on healthcare. Ms. Andrew advises clients in all major aspects of employee benefits. Her practice concentrates on topics such as welfare plans, healthcare reform regulation, and federal and state healthcare laws. Now I'd like to turn it over to Laura Andrew to begin the presentation.
Hello everyone, I hope you're doing well today, and maybe for next time we'll try to have some music for you until we actually begin. And I appreciate that lots of you have actually clicked on early. So today we are going to be talking about SPDs, SBCs, and SMMs. So just to tell you a little bit, I'm going to give you just a very brief overview of SBCs, SPDs, SMMs, and risk plan documents. And then I'm going to talk about some pitfalls about each of those. And then just a couple of thoughts on welfare plan audits, and then of course just some final parting words. So first, let's talk about SBCs. So as you know, health insurance providers and employers, if you're self-insured, have to create a summary of benefits and coverage. And this summary, as you know, it's in a standard format, and it became effective with the Affordable Care Act back on December 2012. And this SBC, it is a joint emphasis by both the Department of Labor and Health and Human Services. And I'm sure all of you know and are using the updated SBC that was released in April 2016 that were effective for the first plan year beginning in 17. So SBCs apply to most group health plans, fully insured and self-insured, and even grandfather plans with, if you joined me last time, we talked a little bit about grandfather plans, which are plans that are exempt from certain requirements of the Affordable Care Act. They are not, however, exempt from the SBC requirements. Now, there are certain plans that are not included, and those are what are called accepted benefits. And this is as defined by HIPAA. So that includes your standalone dental and vision plans. These are the plans that are completely separate from your medical plan. So they basically have their own plan documents. And then flexible spending accounts, most of them are exempt. And retiree-only plans. And a retiree-only plan is defined as a plan that covers 2 or less current employees. They are also exempt from the SBC requirements. So health reimbursement arrangements, or HRAs. And in case you're not familiar with them, those are basically a plan set up by an employer which does not have any employee money, only employer money. And it's to provide generally a set amount for employees to be used towards health plan deductibles and other things. So they generally don't meet the definition of accepted benefit and are subject to SBC requirements. However, HRAs generally must be linked with the major medical or the medical insurance. Therefore, you can just include any information about that in the SBC. And just in case you're wondering, that would generally be included when you're talking about the overall deductible. That's where you might say an HRA will provide X dollars towards the cost of your deductibles. If you have a standalone HRA, it has to have its own SBC, but as you know, there are only a few small employers that can have standalone HRAs now due to law change. So let's talk about health savings account. Now, a health savings account is generally not considered to be a group health plan. It is not subject to the SBC requirements, because as you know, a health savings account is actually owned by each individual participant, normally set up at a separate bank or multiple banks. And it is a tax-favored account, but it is not considered to be part of the employer's group health plan, even if you make a contribution towards that HSA. So if you put together a high deductible health plan, which, as you know, if you're familiar with HSAs, the only time that you can put money into a HSA is if your plan is a high deductible health plan as defined by ERISA. So in that case, you will have to mention the impact of any employer contributions to the HSA and its effect on the deductible. Again, similar to how I mentioned with the HRA, an HSA, if you pay, say, $500 towards the cost of the deductible by making that contribution to a participant's HSA account, you would indicate that. So just one other comment is even exempt FSAs or HSAs might need to be referenced in SBC as a way of explaining the plan's deductibles and other co-payments features. So as a reminder, the new template, this is the one that was effective in 2017, it's 5 pages, 2 1/2 double-sided pages. And the introduction paragraph, of course, provides information about the purpose and structure of the SBC and links to the uniform glossary. And one of the changes is that terms defined in the uniform glossary are hyperlinked directly to the definition if you're using an electronic version of the SBC. Now, as a reminder, the SBC must include a statement as to whether the plan provides minimum essential coverage and whether the plan pays at least 60% of the total cost of benefits. And that is, so you've got your minimum essential coverage requirement under the ACA and minimum value, which is the 60%. Okay, so in addition to including the uniform glossary in the SBC itself, you also have to make the uniform glossary available in paper or electronic form. And as you know, the uniform glossary is one that's developed in conjunction with HHS and DOL and major healthcare providers. And they came up with common definitions. And although you can provide it with request, you can't modify it. There's no method for that to be modified by any healthcare plan. Now, if you have employees that are outside of the country, but you provide coverage, that is your expatriate coverage, the plans that can offer instead an internet address or other contact information about the benefits and coverage. You don't have to actually send the SBCs overseas. So just a reminder, it's a uniform format, which is why there are not many pieces of it that you can change. And it's intended to help compare plans and benefits. And as you remember, there's 3 examples that it gives. It gives the example of having a child, of having type 2 diabetes, or having a fracture. And then it gives samples of what that would mean. As an employer, you're required to distribute it without charge to your participants and beneficiaries for every medical plan you have when they first become eligible during your open enrollment and upon request. Now, also in addition, if you make a change, then you're going to have to redistribute, make certain changes, you're going to have to redistribute the SBC. So what are the penalties if you don't comply with these rules, as I've just talked about? Well, specifically, if you willfully fail to provide the SBC to a participant or beneficiary, you can be fined up to $1,128 per participant or beneficiary. And as you know, that amount might be different than an amount you've heard before because it's indexed for inflation, and that's the 2018 number. And then addition, you've also got an IRS compliance issue because you have to self-report that you are not in compliance with the ACA on IRS form 8928, and you have to pay an excise tax of $100 per day per individual for each day that you fail to comply with the requirement. Now, I will tell you that there are exceptions to that, and there are certain reasonable cause explanations that you can give so you can avoid having to pay that excise tax. But that is the actual penalty that can be applied. So if you are distributing it, it has to go to eligible participants and beneficiaries. And you can send it electronically if the format is readily accessible and you say that you'll provide it in paper and free of charge upon request. If you post it on your intranet, then you also have to notify the individual by email or paper that it's also available, how it's available on the internet, and also that they can get a paper form. And you can provide a single SBC to a family unless you know a family member lives at a different address. For example, if you know that a 24-year-old dependent lives at a different address, then you need to send it to that different address for that particular dependent. So what are some of the other pitfalls about the SBC? Well, you can provide it as a standalone document, or you can combine it with the SPD, so long as the SBC is prominently displayed early in the SPD, and that the SPD is provided within the timeframes that I previously mentioned. However, as we're going to talk about in a few minutes, SPDs have different timing requirements. So you would have to possibly actually send the SBC more often than you would the SPD. So technically you can do it. I wouldn't say that I would recommend this, though. However, I certainly have seen where individuals have included the SBC and the SPD in a single mailing, but not actually combine them into a single document. But it is specifically permitted by the regulations. So I did at least want to make you aware of it if you're interested in doing that. So just one pitfall that I don't think people are that aware of is if you make a change, a material modification to the SBC outside of renewal or open enrollment, and you make a mid-year plan design. For example, if you're a calendar year plan in July, you decide that you're going to change the deductible, then you have to provide notice of that modification, and it has to be no later than 60 days prior to the date that that modification is going to be made. So it's actually an advance notice requirement. And as we're going to talk about in a few minutes, the SPD has a similar requirement, but it isn't required to be provided in advance. So let's talk about the SBC's language requirements. And I know you probably remember seeing this from the regulations. It has to be provided in a culturally and linguistically appropriate manner, which is similar to other ACA rules for group health plans, claims and appeals communications. So you have to disclose the availability of language services and provide a written translation of the SBCs if it is in certain counties that have been identified by the US Census Bureau as having a concentration of at least 10% who speak the same non-English language. So I would say one thing I would suggest is that before open enrollment, either you or your carrier double check and see whether you have to have it prepared in another language. So the U.S. Department of Health and Human Services has already done some written translations of the SBC template in the following, in Spanish, Tagalog, Chinese, and Navajo. And I've given you the link because it's actually CMS, which is another part of HHS, is where you actually can find the document. So I've included it here. I know it's kind of long and awkward, but you will have it when you get your PDF if you need to look at those translations. And that will also take you to where you can see whether or not there are counties, you're in counties where you're going to have to provide it in other languages. So you need to make sure that you are not required to provide it in another language. If you are a fully insured plan, then your carrier should be doing that, but you want to make sure that it's happening. And another thing is, if the ERISA SPD rules require you to provide something in a different language because of your workforce composition, it's likely the SBC may be required, and even if it's not, you may still want to provide it in that other language. For example, Spanish, if you're having to do provide an ERISA SPD in Spanish. Okay, so now let's talk about the SPD. We're going to move on. An SPD is a summary plan description, and it's intended as a summary of the plan, but it's supposed to be written in a way that the participants can easily understand it. Now, that's a relative term because unfortunately, there are so many specific requirements that it is not always easy to understand. And Section 402 of ERISA, in case you were wondering, is the section that requires that they establish and have written documents, of which the SPD is a very important one. So in day-to-day benefit administration, it's important to understand the difference between the two documents, ensure that the documents are consistent in their terms. For example, plan amendments may have to be made to your underlying plan document, but then they're also going to need to be made to your SPD. And typically the plan document provides more details than the SPD and should be referred to when administering the plan. And just as a reminder, the plan document, the SPD, needs to be available for participants to look at. So you should have, in locations where you have a sufficient number of individuals, you should have an actual plan binder where they can locate it. And then oftentimes in the intranet, you'll have a special page where all of the benefits are located. So just remember that the SPD and the plan document need to be consistent, and it's likely that if you are amending the SPD, you will need to amend the plan document as well. So sometimes employers have an SPD but not a separate plan document. And that happens sometimes with some welfare benefits where they're fairly simple, and so you have the SPD also be the plan document. That could be, for example, a severance plan. So then the courts look at if all the requirements of plan documents in the SPD are met. And in some cases, they've said they're not in compliance because a plan document cannot be both. But I will tell you that in the welfare plan world, that's not common, but you do need to be aware of this potential risk if you put the plan document and the SPD in a single document. So if you have a fully insured plan, as I've mentioned before, the insurance carrier, they're going to provide you some documents like a master contract, a certificate of coverage, a summary of benefits, but they don't provide everything that you need under ERISA. So the employer, who is typically the plan administrator, still has to look and see what needs to be added to make this document meet ERISA's requirements. So it looks like my slides are a little out of order here. Sorry about that. So informing participants and beneficiaries, I'll come back to that in a minute to talk about the wrap. So informing participants and beneficiaries about the plan and how it operates is important. And the SPD is supposed to translate the legalese of the plan document. And it's calculated to be understood by the average plan participant. And then the one comment I really wanted to make here is that potentially, if necessary, you could have different versions of the SPD if necessary, but you've got to be careful if you do that they're all consistent in terms of describing the actual plans. And the SPD has to be accurate and comprehensive, so it gives your participants and beneficiaries reasonable understanding of what their rights and obligations are under the plan. So now let's talk about the wrap. Going back to what I was talking about earlier is if you decide that you're going to wrap your plans, evidence of coverage and SPD documents together, you can do that and distribute it in one piece. And this is referred to as a wrap document or a wrapper document. So one of the benefits of this is if you distribute this together, then you will be providing what you need to from ERISA, and also including the fully insured components of the plan that that are required to be covered. So I will mention here, just as a comment, is that you also see a wrap document, which is a different kind of wrap, which is used when you have multiple welfare plans, for example, medical, dental, vision, life insurance, etc. You can put in place an overall plan document called wrap that wraps all of those together for purposes of compliance and also for purposes of the annual reporting requirement if you're subject to that, so that you don't have to file a separate form 5500 for each one, so you can do them all together. So there also is a separate kind of wrap, and I wanted to mention that so that you were aware of that as well. So the extensive regulations that SPD has developed, and when you're incorporating the evidence of coverage, you have to, this one definitely should have been before the other one. We're talking about the wraparound that I just talked about. So here are some of the things you do need to include. You need to have the ERISA plan number, the identification number, how the plan is funded, and other information that is not included in the evidence of coverage, or the SBC. So an SBC and an evidence of coverage, or EOC, can supplement an SPD, but each is different. And again, you have to provide translation of the SPD documents to non-English speakers free of charge if that's necessary. So what I normally tell employers is when you get your documents from the insurance carrier, you take a look at it and you see what is missing that needs to be included from ERISA, and you create a document that then gets given to each participant along with the fully insured information. So when are you required to give them? Well, you have to give an SPC to participants within 90 days of them becoming covered by the plan. So if it's a new health plan, though, you can have 120 days to create the first SPD. Now, you have to distribute it every 5 years if you made changes. And this is obviously not material changes, which we'll talk about in a minute, but just, minor changes. And if you don't have any changes, you don't have to distribute, but every 10 years. I will say in the welfare world, I've never seen that. You never can go 10 years without making some change to your welfare benefits. And one thing that I didn't really mention here is that there's also a rule that if you distribute an SPD every 90 days, then you don't necessarily have to follow some of these other rules, but that's uncommon that someone would actually send an SPD every 90 days. So now we're going to talk a little bit about SMMs, or Summary Material Modification. And this describes the changes that have been made to the plan. And an SMM, again, has to go to all participants. And it is a change in the information that's required to be in the summary plan description. So it needs to go to the covered employee, spouse, or dependent, and it includes people who have elected COBRA. They should also get an SMM. So anyone that should get an SPD also is required to get an SMM, if there is one. So what are those include? Well, any provisions that establish new benefits, for example, if you add a new benefit, if you take away any existing benefits, for example, if you no longer cover some service that is considered to be important, or if you narrow or expand the circumstances under which benefits are paid. So for example, if you were to change the number of physical therapy visits from 35 to 10 in a year, then that would certainly be an SMM, something you would have to report in the SMM. And you can also use an SMM to terminate the plan. So if you have an amendment that changes the information that is going to be disclosed in your SPD, then an SMM would be distributed. Well, I will say one thing, or you can just distribute a whole new SPD. But oftentimes employers will just deliver an SMM because it's much shorter. So what about SMM and Open Enrollment? If you listened last time, we talked a little bit about this. Open enrollment materials can address the SMM and the summary material reduction requirements for health benefits. So material reductions or modifications or changes that would be considered to be an important plan reduction. And, you know, it's the typical things, changes that reduce or eliminate benefits, increase in co-payments, significant change or reduction to an HMO, and any changes to obtaining services or benefits would be something that would need to be described. So if you do that, you can turn a document given at open enrollment into an SMM so that you don't have to separately give out an SMM. So normally you would provide an SMM within 210 days after the end of the plan in which the material modification was adopted, unless there's a material reduction. And then it has to be provided within 60 days. So one thing I will say about that is if you provide it 60 days after you've made a change, that can be problematic, especially if the change is something like changing your HMO network or changing coverage for certain types of visits, or like I mentioned, changing the number of physical therapy visits. It can be difficult to enforce it, although legally you can do it if you don't communicate it prior to that. And the other thing is if it happens to be something that is supposed to be reported in an SBC, then you definitely run into an issue with that. Because if it's a modification that is supposed to be in the SBC, then that has to be 60 days in advance. So while technically you could provide the SMM 60 days after something happened, you wouldn't be able to also meet the SBC requirements if it was a change that was going to be in both documents. So my comment on this is always, you want to give notice to employees before the fact. It's just a basic, in terms of employee communication, it always makes sense to let them know ahead of schedule so that you do not run into an issue where you have someone who went ahead and had a service thinking it was covered and then it turns out it has been taken away. And again, open enrollment materials are great for that because normally you're detailing the changes that are going to be effective for the plan for the next plan year. And that way you're giving them the advance notice. Now you will have to be careful about the timing of that, but it certainly is something that I would recommend. So in talking about the SMM, it's got to be delivered in the same way that the SPD is delivered. And you can do it by first, second, or third class mail. Now, I'm going to make a comment here, is that oftentimes I get asked, are you supposed to send documents by certified mail? And I would say in terms of SMMs or SPDs, I would not recommend certified mail. One first reason it's not required, and the second reason is many times individuals will not pick up certified mail because they're afraid it's going to be a lawsuit or something else that would basically they're trying to avoid hearing bad news. So I would not suggest for just a basic delivery in SMM or SPD that you send it certified mail. As long as you do it something like first class mail or even second class mail, as long as it has return, it will be returned if it's undeliverable so that you know that it hasn't been, then that is still going to comply with the rules. And it will certainly be less costly than trying to send things out certified mail. And of course, you can also send it electronically if you can meet the DOL electronic disclosure rules. So what are the penalties if you fail to provide it? Well, you could have another one of these lovely per day penalties, $110 per day. And then if it was a willful failure, and that would be you basically say, I'm not going to provide SMMs, then you could have a fine of up to $100,000 and you could go to jail. Okay, so obviously a pretty severe penalty. So now I'm going to talk just for a couple of minutes about welfare plan audits. So because of the enforcing compliance with the ACA, the federal government has started regular audits of group health plans. And in these audits, it includes ERISA compliance. And according to an official of the Department of Labor, and this was not official guidance, it was said at a conference, he said in 2013, more than 70% of the audits resulted in fines or other corrective action. And I believe that because it's very difficult to do everything perfectly right. And if they're checking everything, they may find one small mistake. So the common triggers for audits are either participants complaining to the Department of Labor or incomplete or inconsistent information. For example, your Form 5500 in a report has inaccuracies on it or other information that is clearly incorrect, then those can be audit triggers. So if an audit occurs, then you're going to have to supply the DOL with significant documentation related to both ERISA and the ACA. And then they also may check into your compliance with COBRA and HIPAA. If you're self-insured, they may want to see your HIPAA privacy policies and procedures. And I will tell you the most common issue is having and maintaining an up-to-date SPD. And if you don't, the government has issued penalties, you know, in the $10,000 to $18,000 range for failing to provide an SPD when someone requests it. Now, you know, as a reminder, no employer is too small to be required to have an SPD. And also no employer is too small to have an audit. Sometimes the IRS and the DOL do random audits and you just get randomly chosen, or they pick an industry. And again, they also do the ones based on participant complaints. So everyone needs to be in compliance regardless if you have 10,000 or 10 employees. So just to recap your distribution rules. SMMs within 210 days after the end of the plan year in which the change is adopted, unless it's a material reduction, and then it has to be 60 days after adoption. SPDs no later than 90 days after they become a participant or begin receiving benefits, or 120 days after the plan is established. And while SPDs are not required to be distributed during open enrollment, they can be, or they can be given out after. I will say that oftentimes what I see is that when people select a plan during open enrollment, they could get a copy of the SPD prior to selecting it if they wanted to, but otherwise it would be sent to them after they make their election. So just some final comments, and then I can take a couple of questions because I see my time is running out quickly. The rules, as I've just gone through them, first of all, it's full of acronyms. And compliance with the SBC, SPD, and SMM, they are complex. So if I would leave you with anything, is that the written materials have to be carefully drafted and really vetted for accuracy and compliance. You should make sure that your materials accurately list the requirements of your plan. And even if it's a fully insured plan and you get it from your insurer, you may need to make sure that it says what you think it does and that it's what you negotiated with that insurer. And you need to make sure that your open enrollment materials are accurate. And if you can include all the important changes to the benefits and what plan they affect, etc., then you can make that an SMM, and you will also meet your SMM requirements. And as I mentioned before, you have to have a central location for all your important plan documents, whether it's paper or if it's virtual in terms of an intranet that everyone can access. And then just one final comment. When you put in place all these plans, typically the plans need to be signed. And you need to make sure that they are signed and that you retain a copy, a signed copy, in what I would call an official plan file. So at that point, I'm going to take any questions that you may have. I haven't seen any pop up in the window, but if there are any other questions, I'm happy to answer them at this time. So it doesn't look like there are any questions for me at this time, but I do appreciate you spending your lunch hour with me again today. And now I'm going to turn it back over to Sharon.
Thank you for joining us today. We hope you'll join us for the next webinar on September 12th, ACA Reporting and Penalty Response. Again, we will reach out to provide you with PDFs of this presentation. Thank you and have a great day.